Sickle cell disease is a disease that affects the red blood cells in your body. Normally, red cells are round, soft, just like donuts, and they move easily through your blood vessels, and they carry oxygen all over your body. But if someone has sickle cell, their red blood cells becomes shaped like a sickle or a letter C. These cells are hard and sticky, and they don't move well through the blood vessels. What happens in the body is that the sickle shaped cells or the C-like cells, they block the blood flow, causing pain and damage to the organs. These cells break down easily, and so the person doesn't have red blood cells, which causes something we call anemia. The person may get infections easily. The patient may feel weak and have swellings in the hands and the feet. Symptoms of sickle cell. The most common symptoms are chronic tiredness, which is due to anemia. Most of the time patients will present with anemia. Then another symptoms we have is severe pain. You see, when the sickled cell or the C-like cell moves through the blood vessel, the patient will feel so much pain and they'll have something we call pain crisis. Another symptom we have is a patient will present with swelling in the hands and in the feet. Another symptom number 4, we have frequent infections. A patient with sickle cell will present with infections all the time. Symptom number 5, we have delayed growth, mostly in children. Their milestone will be slow, so they will have delayed growth. And lastly, patients will have vision problem. How does a patient get sickle cell? Sickle cell disease is inherited. Most of the time, the patient will inherit it from the genes of the parents. Like if one parent passes it on to you, you will have something we call sickle cell trait. And that usually the patient doesn't get symptoms. But the person can pass the gene to his or her child. Diagnosis of sickle cell. Most of the time, sickle cell disease is screened in newborns. Like when the babies are born, most of the time they are screened for sickle cell. That's the first way of diagnosing sickle cell. Then we have something we call hemoglobin electrophoresis. These are tests to confirm the type of hemoglobin someone carries in his blood. Treatment options. There is no universal cure for sickle cell, but there are treatments that help to manage the symptoms. Number 1, we have pain relief medication. Most of the time, these patients will present with severe pain, something we call pain crisis. And most of the time, we'll have to treat that pain with pain medication. We have a drug called hydroxyurea. Hydroxyurea is a medication that helps reduce the sickle crisis. We reduce those pain crises. Then we have blood transfusions, because I've told you one of the symptoms of sickle cell, patient presents with anemia, severe most of the time anemia, and then so you'll have to transfuse, and that is one of the management or treatment of sickle cell. And finally, we have vaccinations and antibiotics to prevent infections. So most of the time we'll be giving out antibiotics to treat infections, because these patients mostly present with frequent infections, like each time they'll contract malaria, chest infections, they'll present with frequent infections, and so you'll have to treat with antibiotics to cover those infections. uh, and in some cases, patients who are able, they do bone marrow transplant, and this can be a cure, but not all patients are able to have such a procedure. So for patients living with sickle cell, things that might help: first, patient should drink plenty of water, eat healthy foods, get enough rest, and avoid stress, extreme cold, and heat. They should not be exposed to extreme cold or heat, and have regular medical checkups. So, so that is all about sickle cell or sickle cell disease. And today I had this boy. I really felt so bad for him. He had severe anemia. The veins has collapsed until we were just, the only option was to have the IV line through the head, because there was nowhere else we could find a line for transfusion. So that's why you can see in the videos, you'll see that this boy, his IV line was put through the head, and because he was in a crisis, feeling so much pain, severe anemia, but eventually he'll be fine. So if you have a patient, or you have a child, or you have a sister, brother going with sickle cell anemia, please just follow the instructions and the things we have shared, and you'll be fine. Please, and if you're new here, you haven't subscribed, please subscribe and join the family. Here we share more about medical problems and issues, and if you have any questions, please feel free to drop the question in the comment section, and I'll respond to it. And thank you so much for your support and love, and I'll see you again in the next one. Bye.